So hello friends, welcome back to my channel Medicine of 101. Today we'll talk about acute pericarditis. So from the term it's quite easy to understand. The pericarditis means you'll get the inflammations within the pericardium. So before going into details, let's know about the normal features in terms of the structures and the functions of the pericardium. Okay. Now if I say, for example, is the right heart is the left heart. As we know, there's pericardium is what? Basically it's the double sac layer. So if I write it over here, okay, let's do this. Okay. So basically, if we write it over here, the pericardium is the double sac layer, right? This is a double sac layer. Now, if I show you over here, for example, I'm just showing with this color. I'm just taking this whole. Okay, don't get confused. I just do differently for them. Okay. And if we see the structures for these things, we'll get the inner surface or the inner sides of the pericardium. This is known as what? Visceral pericardium, and the outer one, that is what? That is known as fibrous pericardium. So, or you can say the parietal pericardium. Now, if we see the structures over here, try to understand, we'll get what? We'll get the myocardium, right? We'll get the myocardium from here to here in the ventricular layers. And if we see outside of this structure, that is known as what? Epicardium. Then we'll get myocardium, then we'll get endocardium. Now basically we will get, for example, if you consider this thing the endocardium, this is the myocardium. If I just consider this the, okay, let's draw these things in this way. For example, is the endocardium. So we'll get the the visceral layer of the pericardium that is firmly attached, with the epicardium. Okay. Now if I show you over here with this color, see these portions we are getting over here. That means there is the visceral pericardium. So the visceral pericardium we are getting over here. Okay. So if you write it over here, the visceral pericardium, this one, visceral pericardium, that is firmly attached or tightly attached with epicardium. That means innermost will get endocardium, then you will get the myocardium, then you will get the epicardium. Why I am saying this thing? Because whenever we get the inflammation within the pericardium, sometimes we can see there is spreading of the inflammations from the visceral pericardium to the epicardium, and from the epicardium the infections that can goes further to the myocardium. And what about the outer structures? The outer structures, that is, we will get over here. There is the fibrous structures. We will get the collagenous fiber. This is the what? Parietal layer, right? It's the parietal layer. So the parietal layer of the pericardium. We can also parietal pericardium. Now basically it's the fibrous structures with the collagenous tissue. Okay. Now this is the normal structures, and we'll get in between the two layers of the pericardium we'll get the fluid. How much? Around 15 to 50 ml. So here we'll get the fluid. Okay, let's show the fluid with this color. We'll get the fluid within the pericardial sac. Now the fluid will get around 15 to 50 ml. That means 15 to 50 ml. That means the upper limit of the fluid, that is what? 50 ml. If we get more than 50 ml fluid within the pericardial sac, that conditions we can consider as what? Pericardial effusion. Okay. Get the fluid more than 50 ml. This condition that will be regarded as pericardial effusion. Pericardial effusion. So we'll talk about these things in the subsequent parts whenever I talk in terms, especially in terms of the pathology in details. Okay. Now what is the function? This is normal structures, we can say in 2-3 words. And what about the functions of the pericardium? Now the functions of the pericardium, from here we can understand this pericardium that helps the heart to remain in the stable positions. Try to understand. First, if we say that this pericardium, for example, this is the pericardium over here. This pericardium helps the heart to be in the stable conditions, to be stabilized in the positions where within the mediastinum, right? So first thing, if we write it over here, what's the functions of the pericardium? So in terms of the function, we can write over here, helps the heart to remain stable. right, in their position, in its position. Okay, within the mediastinum. Now second function, see, for whatever the region, if we see within the vein, the venous return is getting increased. Whenever the venous return is getting increased at the time, the heart that will get straight. So this pericardium that will inhibit the over distensions. See, this pericardium that will inhibit the over distensions of the cardiac chambers. So it will not it will not let the heart to get extended than the normal limit. Okay, so we can write it over here. The second functions that inhibit the over distension of the cardiac chamber, right, of the cardiac chamber. Third thing, it will prevent the microbes from the other neighboring tissue. For example, someone is having the inflammations within the lungs. At that time, this pericardium that will inhibit the microbes to go from the lungs to the heart, from the lungs to the heart. So it will also inhibit. Okay, so you can write it over here. It inhibit also microbes to go within the heart. That means it will work as a protective mechanism, protective factors. Now we can see the protective mechanisms of pericardium that will not allow any kind of microbes from the neighboring tissues or from the circulations to go within this, from the the inner structures of the heart, from the pericardium to the inner structures of the heart. It will work as a barrier over here. Another thing we can say that within the pericardium, there is the originations of the large blood vessels. For example, if you see in terms of the didn't just extend this part, we'll get also the pericardium over here. So within the pericardium, we'll get the originations of the large blood vessels for in terms of the aorta, in terms of the superior vena cava, inferior vena cava over here also. Okay. So we'll get the origination of the large blood vessels also over here. Okay. Now we'll talk about the disease of the pericardium. Disease of the pericardium, and these things. Okay, I think you know it. Yet let's say once more that whatever this fluid, the functions of this fluid, whatever we are getting from the 15 to 50 ml, it will reduce the frictions whenever we will see the systole and the diastole. At the time we will see the gliding of these two layers. At the time whenever we will get the gliding of these two layers, okay, at the time this fluid that will reduce the frictions in between the two layers. So as a result, we will not be able to hear the pericardial rubber, the scratching sounds. So it will just prevent these things. Now we'll talk about the diseases of the pericardium. Now whenever we're talking in terms of the diseases of the pericardium, what are the diseases we'll get and the classifications. Okay. Now see, if we say the diseases of the pericardium, see, diseases of pericardium. Here we can get whatever the disease we can get on. If I just make a triad over here, on you can get the pericardial inflammations. So we can get the pericardial inflammation over here. Another we can get the pericardial effusions. For example, I am writing it over here. We can get the pericardial effusion. Okay, and okay, let's use this color over here. We can also get the constrictive pericarditis. Okay, when we will get this pericardial layers that will be fibrotic in nature. At the time it will just what, it will apply the pressure on the heart. So this type of thing that is known as constrictive pericarditis. So you can write it over here, constrictions over here. As a result, we will get the development of the constrictive pericarditis. Now today's topic is the inflammation. So I'll talk about in details about the acute pericarditis. That means in terms of the inflammation. Okay, now let's go in details about the inflammations. So acute pericarditis. Now the pericarditis, whenever we are saying the inflammations, that means definitely the inflammations of the pericardium, that is known as pericarditis. Now clinically we can classify, as far as the clinical thing is concerned, clinically we can classify the inflammation of the pericardium. That means the pericarditis. Pericarditis in three categories. One, the acute pericarditis. Second, subacute pericarditis, and you can get the chronic pericarditis. Now, whenever we get the inflammations, as far as the Harrison is concerned over here, if we just say that whenever we get the inflammatory agents over there, that will long last for less than 6 weeks. So, if we, whenever we get, okay, let's write it over here. Whenever we get, the inflammatory things over here less than 6 weeks, at the time that thing is considered as what? Acute pericarditis. But if we get for more than 6 months, if we get more than 6 months, then it will be considered as what? The chronic pericarditis. And if we just see the value in between these two, that means from the 6 weeks to, that means more than 6 weeks and less than 6 months, this thing will be regarded as what? The subacute pericarditis. Subacute pericarditis. Okay, so it's clear for you. Now we'll talk about we'll just do the classification as far as the etiology is concerned. So whatever the thing we can get over here, see. So we can get in this way, as far as the etiology is concerned, we can get the infective, we can get for the hypersensitivity, we can see, and we can see another type for non-infective or not hypertensive. So if we write it over here, okay, let's classify as far as the etiology is concerned. So etiological classification. Etiological classification, we can get over here first. Okay, the infective, we can get the infective pericarditis, we can get hypersensitivity, we can get the development of the pericarditis for the developing of hypersensitivity. Okay, hypersensitivity, and we can also say in terms of the non-infective and hypersensitivity mediated regions. Okay, now we can get these things. Now, as I said, the most common type of the try to understand the most type of the etiologies over here we can get in terms of the what? That is idiopathic. Now, whenever we are talking in this way, that idiopathic, that means see, whenever we are talking in terms of the idiopathic, near about 80 to 90% of the cases in terms of the acute pericarditis will get idiopathic. Now, whenever scientists that did study about it in details, at that time they came to know that most of the cases that are the viral related. So what type of thing will get over here? If I say over here, the most common that will be definitely the infective pericarditis, but it is also known as the idiopathic. But within the idiopathic, they came to know around 80 to 90% of the cases as for the viral cases. Okay. Now at first we'll talk about the infective pericarditis in details, then we'll go back to the hypersensitivity mediated pericarditis. Then in the third number we'll talk about the non-infective or non-hypersensitivity mediated pericarditis. So whenever we'll talk about the infective pericarditis, let's write it over here. What are the thing we'll get over here? So infective pericarditis. See, as I said, it is idiopathic, but yet we can get sometimes of the virus, they can just cause this type of situation. So whatever the virus we get over here, the most common virus that can cause this type of the thing, that is known as Coccyx virus. That is the Coccyx virus. Within the Coccyx virus, we will get two groups, Coccyx A and Coccyx B. Now, out of the Coccyx A and Coccyx B, it's more specifically you can see the Coccyx B that is more responsible for causing the infective pericarditis. Okay. What are the other viruses that can also cause the infective pericarditis? So these are the viral. Okay, let's write it over here. We'll get in terms of the viral regions, viral etiologies. Other things we can get over here, there is the Epstein-Barr virus. So we can get over here another virus, Epstein-Barr virus. So when we are talking in terms of the Epstein-Barr virus, try to understand it is also developing. It can also develop toward the kissing syndrome or kissing disease, we can say. Because try to understand, whenever someone is getting infected within the Epstein-Barr virus, at that time through the saliva there is a chances for the getting for spreading the infections of the what? Infectious mononucleus. So through the saliva, these things can be spreaded from the infected persons to the normal individual or healthy individual, and that can cause the kissing disease over here. Now the Epstein-Barr virus that can also cause what? The infective pericarditis. Other regions we can say over here HIV that can cause also the infective pericarditis. Another term for HIV, you can just remember this thing, that HIV just cause the predispositions for the TB, for the tuberculosis. Okay, HIV is the predispositor, or you can say that it can cause the predispositions for the TB within the within the white pericardium. Now, apart from the viral regions, we can go to the bacterial regions. What are the bacterial regions? Now see, whenever I just said about the Coccyx A and B group, this Coccyx A and B, they are not only cause the the pericarditis, they can also cause the myocarditis. They can also cause the myocarditis. They can be spreaded from the pericardium to the epicardium, from the epicardium to the myocardium, and that can cause, you can go after going there, they can cause also the inflammation of the myocardium. So you can remember these things. Now we'll talk about the bacterial regions. So basically, whenever we talk about after viral, whenever we are talking in terms of the bacteria, whatever the bacteria involved over here, so let's write it over here. Basically, we'll get the pyogenic bacteria. Whatever the bacteria is, pyogenic bacteria. Pyogenic means definitely they will form the pus. Whatever the bacteria we will get over here. Okay. So whenever I just said in terms of the pyogenic bacteria, we will get the Staph aureus. We get the Staph aureus, we can get the Neisseria. Okay, this type of thing we can get. Now you know what are the pyogenic bacteria. I'm not going in details. I have a separate video on that, okay, on microbiology. So you can watch over there. Now whenever I am saying that bacteria, now see how the bacteria they will come, how the bacteria they will reach from the other tissues, or we can say from the neighboring tissue to the what? Pericardium. Now one thing, through the hematological route, the bacteria they can go from the different tissues to the what? Different tissues to the pericardium. Now if I say over here, for example, is the, try to understand, if I say is the pericardium, is the pericardial structures over here, okay, and as we know, for example, within the lungs of an individual, he developed the pneumonia, for example, and whenever anybody or any individual is developing the pneumonia, definitely the microbes or the positive organisms, in terms of their antigens, these antigens can come from these portions to the what? From here to the, these are the pyogenic bacteria, right? These are the pyogenic bacteria that will cause the pneumonia, and from here this can spread to the pericardium. Another thing, sometimes we see that within the pleural cavity, within the pleural space, for example, if I, okay, let's use the different color for, okay, let's use this color. So sometimes we can get in between the pleural layers, try to understand, sometimes we can get in between the pleural layers, the accumulations of the pyogenic bacteria, they can cause the infections here as well. So whenever we will get in between the pleural layers over here, okay, the accumulations of the pyogenic bacteria, from here we can get also spreading of the what? Bacteria to the pericardium. Now this type of thing that is known as what? Empyema. Okay, let's write it over here. Empyema thorax, right? This type of thing known as empyema thorax. So from here we can get the spreading of the bacteria. That means from the neighboring tissue, you can see over here from the lungs. In terms of the pneumonia, the bacteria that can cause the pneumonia, their antigens that can be spreaded from the lungs to the pericardium, from the from the what? Pleural cavity, or we can say the pleural space, where you can get the empyema thorax. From here you can also get the development of the or spreading of the bacterial antigens from this space to the pericardium. Okay. Now we'll talk about the other causes and whatever of the other bacteria that are involved over here. Now in these cases we will talk about another bacteria. For example, if we get the TB, tuberculosis bacteria, okay. Now whenever the TB they will come over here within the pericardium, and they will cause what type of the inflammations, that is known as what? Caseous pericarditis. Caseous pericarditis. Now whenever the TB that is coming over here, that is causing the caseous pericarditis. Now not only TB, but also many kinds of the pericarditis we will get as far as the fluid is concerned over here. So whatever the things we will get, let's talk about those things. Okay, for that thing, okay, I'm just erasing this part over, guys. Okay. Now, as far as the fluid is concerned, within the within the pericardial space, what are the fluid you can get? First, fluid in pericardium. So what are the fluid you can get over here? Try to understand the first of the fluid you can get the transudative fluid. I'll explain each of detail in details. Transudative, we can get the transudative fluid. Now we can get serous fluid. That will cause the that can also cause a little bit of the pericarditis over here. It's the mild over here, you can see. Then we can get the fibrinous pericarditis. For the depositions of the fibrinous tissue over here, how it is getting deposited, I will talk in details. Then we can get suppurative pericarditis, and you can get also hemorrhagic pericarditis. Now we'll talk about in details all of them. Okay, so for that thing I need to erase some part from here. Okay, so please watch. I'm just erasing this part from here. Now, as far as the transudative fluid is concerned, what type of thing will get over here? Try to understand. As I said before only, that within the pericardium will get also the origin of the blood vessels, right? So within the pericardium will also get the blood vessels that will supply the pericardium. So if I say over here, for example, if I get the pericardium over here, and I'm just showing the pericardial structures, okay, in this way. So definitely we'll get what? Definitely try to understand within the structures we'll get the blood vessels. So within the blood vessels we'll get the endothelial cells. For example, it's the lining for the endothelial cells. Okay. So it's the lining of the endothelial cells. So try to understand from here, guys. So for whatever region, if we get, what do we know in this cases? There are two factors that will work over here. One is the hydrostatic pressure and another is your oncotic pressure. So when you are talking in terms of the, try to understand, when you are talking in terms of the hydrostatic pressures, this hydrostatic pressure that will push the fluid from here or the nutrients from here to here, the fluid that will come. But whenever, as we know that, the interendothelial gaps, we will not see the significant interendothelial gaps will be developed over here. So there will be no interendothelial significant gap. As a result, in these cases, we will get only what? Only the fluid that will go, but no protein. Right? Now, and the oncotic, whatever the fluid will come over after giving the supply, after giving the supplement, all these things in terms of the nutrients, gases or whatever you can say, by the oncotic pressures, all these things that the fluid that will be pulled again where within the microcirculations. For whatever the regions, if we see that the hydrostatic pressure is getting increased, and osmotic pressure is normal, no problem. But in this cases we are getting the endothelial cells normal. That means in between the endothelial cells the gap is normal. There is no significant increase in the interendothelial gap. So here if we can write that endothelial cells normal. Now whenever, for whatever the regions we will get over here, the hydrostatic pressure is increased. So whenever the hydrostatic pressure that will be increased over here, try to understand. So we will get the accumulations of the more amount of the fluid. So whenever you are getting accumulation amount of the fluid, this type of the thing, okay, so hydrostatic pressure is getting increased. So accumulation of fluid, this fluid is what? Protein poor fluid. Will not get significant amount of the proteins within this fluid. So protein poor fluid. Now this type of the fluid that is known as what? Transudative fluid. Transudative fluid. Hope it clear for you. Now in opposite to that, if we say for whatever the regions, if we get the hydrostatic pressure is normal, try to understand hydrostatic pressure is normal. But for whatever the regions, if we get the oncotic pressures, for example, the oncotic oncotic pressures that is getting decreased. Whenever the oncotic pressure that will be reduced, at that time try to understand. So definitely the protein that will be less within the plasma. So whenever the protein amount of the protein within the plasma that will be less, so try to understand the protein, the plasma, they will be not able to hold the water molecules. So whenever the plasma, they will be not able to hold the water molecule as the osmotic pressure dropped. As a result, this fluid from the microcirculations, they will go where? Within the pericardium. And the same type of the fluid also get over here, that is known as transurative fluid. This is the transurative fluid. Now we'll talk about the second thing, the serous, serous fluid. When we will get the serous fluid? Now it was what? It was all about the transurative fluid. So let's write it over here, transurative fluid. Okay. Now we'll talk about the serous fluid. When we'll get the serous fluid? Then we'll talk about the fibrinous, then we'll get the suppurative, then we'll get the hemorrhagic. So now we'll talk about in details about the serous. It is the transurative. Now serous fluid. When we will get the serous fluid or the serous pericarditis for the developing or the accumulations of the serous fluid, in the same way we will draw the pericardium. Now in this case, just try to understand from here, guys. I am just enlarging this part from here to here. Whatever the origins, if we get that there is, okay, for whatever the regions, if we see there is the mild injury where within the endothelial cells, if we get the mild injury within the endothelial cells, or you can say the mild inflammations, then try to understand from here, in between the endothelial cells, the gap that will be increased but not significantly. We will get the very little gap in between the endothelial cells. So whenever we get the mild injury or the mild inflammations where within the endothelial cells, within the pericardium, at that time, so very little amount of the fluid that will go from where? From the microcirculations to the pericardium. So if we get the over here mild inflammation, so if we get the mild inflammations, try to understand from here. So as a result, we will see within the endothelial cells, in between the endothelial cells, we will get the very small gap in between endothelial cells, right? In between endothelial cells. So whenever we will get the very small gap, at that time, whatever the thing we will see, so the very small protein, that means the albumin that can pass from the microcirculations through the endothelial cells and that can come within the pericardium. So here we will get definitely the fluid that will come over here. Along with that, we can see the small amount of the protein, small size of protein. For example, the albumin, we can get the albumin over here. So whenever we will get the small size protein, for example, the albumin along with the fluid for developing the mild inflammations, this type of the fluid that is known as serous fluid. This type of the fluid that is known as serous fluid. Serous fluid. Now, the third thing we'll talk about right now, the fibrinous fluid or fibrinous pericarditis. When we will see the fibrinous pericarditis, or when we will get the fibrinous fluid over here. Now see, in the same way I will draw over here again, and I will also extend this part just to understand you guys. Okay, let it a little large. Okay, now try to understand. We will get again the endothelial cells, we will get the microcirculations over here, we will get the microcirculations. Now if we get the moderate inflammations over here, try to understand, if we get the moderate inflammation, if we get the moderate inflammations, at that time whatever the thing we'll see, in between the endothelial cells, we'll get the significant. Okay, so let's continue. So whenever I'm talking in terms of the fibrinous pericarditis, okay, whatever the thing we'll see, in these cases, if we get the moderate inflammations, whenever we'll get the moderate inflammations, try to understand. So whenever we're getting the moderate inflammations, so in between the endothelial cells, the gap in between endothelial cells, that will be also increased. So we'll get significant increased gap in between the endothelial cells. As a result, we will see not only albumin but also large size protein, for example, the what? Fibrinogens. So fibrinogen that can also pass from the circulation, microcirculations to the what? Pericardium. Okay. So whatever thing we'll get over here, whenever we'll get for the moderate inflammations, we'll get the intra-endothelial gap that will be increased severely. So not severely, it will also increase moderately, but the gap that will be significantly increased. So whenever we'll get the gap that will be increased over here, definitely what we'll get over here, the fluid that will come over here, along with the fluid we'll get the albumin, we'll get also the fibrinogens. So whenever the fibrinogens that will come within the pericardium, it will get converted into fibrin. So we'll get the fibrinogen. So whenever we get the fibrinogen, it will convert into fibrin. So whenever it will be converted into fibrin, try to understand what type of thing we'll get over here, okay? And this type of the thing that is known as fibrinoid, or so you can say the fibrinous pericarditis. So what is fibrinous pericarditis? Whenever we will get the moderate inflammations, for developing the moderate inflammations, we will get in between the endothelial cells the gap significant increase. So we'll get, so during fibrinous pericarditis we will get, try to understand, we will get the moderate inflammations. So whenever we are getting the moderate inflammations at the time, in between the endothelial cells, the gap that will be also increased significantly. So whenever we will get significant increasing the endothelial gaps over here, as a result, we will get the passing of the fluid. Along with the fluid, not only the small size of the protein albumin, but also the fibrinogen that will go within the pericardium from the microcirculation. So as a result, we will see the development of the fibrinous pericarditis. Now the next other part we will talk about, okay, caseous necrosis. And whatever thing we'll get over here, let's talk about those things. Now try to understand, whenever, one more thing I can say over here, whenever we get the fibrinogen that will be converted into fibrin, or we are getting the development of the fibrinous pericarditis, in these things, try to understand these things. Whenever it will come over here, it will just increase the adhesions, it will increase the adhesions in between the two layers of the pericardium. So whenever it is increasing the adhesion in between this fibrinous compound, in between two pericardial layers, at that time, during systole and the diastole, you can hear the scratching sound, and these are known as pericardial rub. So you can hear the scratching sound, and this is known as pericardial rub. Okay, pericardial rub. Now we'll talk about the hemorrhagic pericarditis. What are the thing we'll get in terms of the hemorrhagic pericarditis? For that thing, I have to erase some portions from here, guys. So from where should I erase? Okay, I'm just erasing from here, guys. Okay. So whatever the thing we'll get in terms of the hemorrhagic pericarditis. So when we'll get the hemorrhagic fluid or the hemorrhagic pericarditis. Now see, if we get the severe inflammations, okay, let's draw these things first. If we get the severe inflammations, when you will get the severe inflammations, for example, we are getting the infiltrations of the cancer cells. Okay, let's draw the endothelial linings first. So I'm just drawing the endothelial lining. So try to understand from here. Okay, whenever we get the severe inflammations, for example, so we are getting the infiltrations of the cancer cells or other inflammatory molecules, mediators are coming also over. For example, we are getting the infiltrations of cancer cells. So whenever we get the infiltrations of the cancer cells over here, whenever the cancer cells, they will reach within the microcirculations, they will just destroy the microcirculations. So whenever we get the destructions of the microcirculations, not only the fluid, try to understand, not only the proteins, the blood, some amount of the blood, they will be also able to go from the microcirculations to the pericardium. So what I am saying, you try to understand, in terms of the severe inflammations, try to understand, For example, we are getting in terms of the infiltrations of the cancer cells. So whenever we see the arriving of the cancer cells who are within the microcirculations, after coming over here, they will just destroy the what microcirculations. So whenever this structure that will be destructed at the time, not only the fluid, not only the small size protein and large size protein, that means in terms of the albumin and the fibrinogen, but also we'll see what the some amount of the blood that will also go from these portions to the pericardium, and that will get accumulated within the pericardium. Now, whenever the blood is getting accumulated, that's why it is known as hemorrhagic pericarditis over here. Okay. So if we get the severe inflammations or the severe injury within the pericardium, at that time, for example, if we see the infiltrations of the cancer cells, ultimately we will get the destructions of microcirculation. So whenever we will get destructions of the microcirculations over here, as a result, we will see not only the fluid will go over here, not only the small size protein, not only the fibrinogens, along with that we will also get the blood, because the endothelial cells, they will get shrinkage, we will get the shrinking of the endothelial cells. Not only this thing, this whole structure will be destroyed, so we will get also the blood. This will get accumulated over here. Now this type of the structure, that is known as what? Hemorrhagic pericarditis. Okay. Now the last thing, that is known as the caseous, caseous pericarditis. Now whenever we will get the caseous pericarditis. Now let's talk about some points about the caseous pericarditis. As I said, in terms of the tuberculosis, we will get this type of the thing. Now in the same thing, the same way we will get over here. For example, let's draw the pericardial structure once more. In the same way, whenever we are getting the bacterial invasions over here, definitely we will get over here that the endothelial cells, that will get shrinkage, because we will get the inflammations. For example, we are getting the severe inflammations. As a result, in between the endothelial cells, the gap that will be increased. So whenever the gap is getting increased at the time, the fluid will also come. Along with the fluid, we will get the protein. So protein-rich fluid, whatever thing we will get over here, we are getting the fluid, we are getting the protein. So protein-rich fluid is getting over here, that is known as what? Exudate. Along with the exudate, whenever the bacteria is over here, for example, the tuberculosis, Mycobacterium tuberculosis is coming over here, at that time it will also attract what? Different kinds of the or inflammatory cells, in terms of we can say neutrophils. Now whenever the neutrophils from the circulations, try to understand over here, from the circulations we will see the arrival of the inflammatory cell, especially we can talk in terms of the neutrophils. Now whenever we will get the neutrophils over here, over here, at that time it will produce what? It will secrete the different types of destructive enzymes, and all these things will get died, and we'll get what? The accumulations of the formation of the pus, and we'll get structures over here, that is known as caseous structures. That's it is known as caseous pericarditis. Hope it's clear for you guys. Okay, so we'll get what? We'll get the transudative fluid over here. For that we can develop the pericarditis. We can get for the serous fluid. We can get for the fibrinous, fibrinogen protein that will come over here. For that thing we can get for the hemorrhagic things. We can get also for caseous. That means in terms of the tuberculosis. So this was all about in terms of the acute pericarditis. In the next video we'll talk about the fungal. There are also, I just said in terms of the bacterial, in the viral. There are also more regions in terms of the acute pericarditis. In terms of the, you can see in terms of the fungal, where we'll talk about in terms of the Candida albicans, toxoplasmosis, different kinds of the things are over here. We'll talk about all these things in details. Okay. After that we'll talk about the hypersensitivity mediated pericarditis, and after that the number third, what I have already mentioned before. Okay. So see you in the next video. So